All right, today we're diving into something incredibly important. We're talking about our own minds, and specifically about those times when your brain gets stuck on a thought and just refuses to let go.
If that quote hits home for you, then you're in the right place. We're starting here because that feeling, that internal spin cycle, can be one of the most isolating experiences a person can have. But it really doesn't have to be.
And this is the core question we're going to unpack. What if all of that shame, all of that feeling alone, isn't because there's something wrong with you? What if it's just based on a simple misunderstanding of how your brain is wired?
To really get to the bottom of this, we have to talk about obsessive-compulsive disorder, or OCD. It's so misunderstood, and honestly, it's one of the loneliest conditions out there, for one simple reason. The entire battle is happening inside your own head.
And this is where the real pain comes from. When you have OCD, an intrusive thought doesn't just feel like a random thought. It feels like evidence. It feels like proof that you're secretly a bad person. And trying to argue with that feeling can hijack hours, even entire days of your life.
And, because of that intense shame, the silence can go on for a long, long time. In fact, it's pretty common for someone to live with these symptoms for more than a decade before they even get a diagnosis, a name for what they're going through.
Okay, so at the very center of this whole struggle is one big, fundamental, and painful lie that your brain tells you. A lie that feels completely 100% real.
This right here is probably the most important thing to understand. Those disturbing thoughts, they don't reflect who you are or what you want. In a wild twist, they're actually the exact opposite of who you are. They are a sign of what you care about the most.
So how does that even work? How can something so scary mean the opposite of what it says? Well, understanding this is the very first step toward finding some relief.
Think of it this way. OCD isn't a disorder of desire, it's a disorder of doubt. Your brain essentially misfires. It serves up a totally random, intrusive thought, and your brain's alarm system goes, whoa, that's a huge threat. It latches on to whatever would upset you the most, because that distress is a signal that something important needs to be protected.
And this comparison just lays it all out so perfectly, doesn't it? The lie, the feeling, is that the thought means something terrible about you. But the neurological truth? It's just a glitch, a brain misfire that's targeting the very things you value the most.
And this example just brilliantly drives the point home. Why would a deeply loving parent have a terrifying, intrusive thought about their child getting hurt? Because they're a deeply loving parent. Their child's safety is their absolute highest value, so that's exactly where the OCD alarm decides to ring.
Okay, so if the thoughts themselves aren't the real danger, why does it feel so powerful, so impossible to escape? Well, the answer isn't in the thought itself, it's in how we respond to it.
This is the trap. The thought pops in, and it brings this huge wave of anxiety. So you do a ritual. It could be a physical compulsion or even just replaying something in your mind to get some relief. And for a second, it works. But that little bit of relief just taught your brain, see, that thought was dangerous and our ritual saved us, which basically guarantees the thought will come back and probably even stronger next time.
But here is the really, really good news. There is a highly effective, evidence-based therapy that is designed for one purpose, to break that exact cycle. It's called exposure and response prevention.
So ERP works by systematically helping you untangle that knot. With the therapist's guidance, you gradually allow yourself to face the feared thought. And then, this is the key, you choose not to do the ritual. You prevent the response. And over time, that teaches your nervous system directly that the thought is just a thought. It's not a real threat.
And this isn't just about managing things. It's about finding actual, genuine peace. For people who have lived with a constant alarm bell ringing in their head for years, the kind of quiet that ERP can bring is, well, it's profound. It can be the first time their mind has been quiet in a very, very long time.
So the biggest takeaway here is that you don't have to do this on your own. You're not alone in this struggle. Specialized help is out there, and finding it is the most important next step. Let's just take a look at what that can look like.
So if that idea of a quiet mind sounds good to you, you really don't have to carry this burden by yourself. Just as an example of the kind of specialized help that exists, let's look at a practice in Georgia that really focuses on this exact work.
So a practice like Coping and Healing Counseling, or CHC, in Georgia is a great model. They use telehealth so they can help people all over the state, and they have a whole team of therapists who are specifically trained in ERP. It just shows that this kind of focused, specialized help is out there.
Now, one of the biggest hurdles to getting therapy is, let's be honest, the cost. And a lot of specialized practices know this. For instance, a place like CHC takes Medicaid and a bunch of major insurance plans, which makes this kind of top-tier care way more accessible. It's a great model to look for in your own area, too.
And if you're listening to all this and wondering, does this sound like me? A fantastic, no-pressure first step is to look for a free, confidential screening test, like the one CHC has on their website. It can give you a lot of clarity in just a couple of minutes.
And when you're ready to actually talk to someone, just making that call is the first biggest step on that journey to a quieter mind. For anyone in Georgia, that number on your screen is a direct line to the kind of help we've been talking about.
So let's end on this one core message. I really want this to sink in. You are not your thoughts. You are not the terrible things that these brain misfires tell you. You are the person who is experiencing them, and you absolutely deserve effective, compassionate, science-backed help.
And we'll leave you with that question. Just imagine, what could you do with all that mental space, all that energy, that freedom? A future with less noise and more of you is absolutely possible.